Well, good morning, everybody. And look, firstly, can I acknowledge the traditional custodians of the land on which we meet today and pay my respects to elders past and present. Can I also acknowledge any Aboriginal and Torres Strait Islanders here with us today and also pay my respects to you as well. Thank you, Bill, for the work you do in this space. Again, a great contribution. Particularly to Abby Robinson, who is our innovation champion and organised this event again. Abby and Bill do a fantastic job pulling this event together, getting people into the right space to be able to have the conversations we need to have as a public service and a broader community. Also like to thank the many guest speakers, and there are too many to name, for your generosity in attending today. It's without you, we can't really have the appropriate and right conversations on some of these topics. The Department of Health, is absolutely delighted to host this conference again as part of the Public Sector Network Innovation Month in 2016. Third year we've had this event. And to celebrate and embrace innovation across all organisations. And this is my second one, and this is quite a bit bigger than last year, and last year's I thought was a fantastic event. Great participation, great ideas, great opportunity for people to have their say, have a bit of a think about different things that sometimes we really don't get the opportunity. As Bill said earlier, some 36 different organisations, both public and private sector organisations, coming to just talk about issues of innovation and ideas generation. I think it is absolutely a fantastic way for us to engage in a conversation, how we can actually collaborate with each other, how we can inspire each other to go back and do what we need to do in our everyday lives. So first of all, thank you very much for your participation today. Today's event is about continuing our conversation about what innovation means for us now and in the future. It's about discussing how we can apply everyday practices that encourage and take advantage of innovation. To capture and triage ideas from our staff, which may sometimes need organisational processes rather than just luck to get up. This is our opportunity to think deep and wide, to develop practical understanding of what innovation is and how fostering it is vital for a healthy, agile and resilient future Australian public service. I think there is no time more important than now to make sure we focus on the long-term resilience of the APS. We also want to explore ways that we can make innovation part of our culture throughout the APS, by challenging mindsets and connecting people and ideas. I doubt anyone would deny that the APS has to innovate in order to successfully fulfil its role of protecting and furthering national interest. I'll use a couple of examples from the department. We define innovation as doing things better and doing better things. That is, creating new ideas or finding new uses for old ideas and add value, that add value when implemented. Sometimes we hear things about the old ideas, it didn't work last time, therefore why would you do it again? I'm a great believer in timing is everything. So there are a lot of ideas that have been thrown up over many, many years that may not have had their day yet. Let's not throw them out. Let's actually recalibrate, rethink, toss them around a little bit and see if there is a way we can do that. Success for our department means that we lead, shape and guide the health system to enable it to deliver better health and wellbeing for all Australians now and into the future. That's our vision. That's where we want to take things. We're looking at many challenges across the health system at the moment. And to meet those challenges, we need broad, meaningful reform to that health system. And I think we are progressing some of the reforms that we're dealing with quite well. And sometimes some old ideas again. that we've actually thrown into the mix. We've recalibrated for today and for the consumer need out there, and we've actually thrown them into the mix. I think sometimes issues require new approaches and new thinking, and largely that is what innovation is about. We create a real policy base in our thinking so that we can actually give up the ideas to government when they are required, because they will be required. And I have to say, over the last 18 months or so, that has not been an easy job, but it is an essential job. And I would say, if you get into real reform, particularly in a systems way, it is never easy. But you have to have the courage to keep challenge that. So it's going to be a challenging time for many of us, particularly over the next little while possibly, to find the time to focus on the future and be innovative and strategic. But we do need to make the time and make the investment if we are truly going to get the outcomes we require. The thoughts and actions that we put in place now within our current work environment will influence the future for our work environment, our organisations, and again, the APS as a whole, and of course for the nation, the people we serve as public servants. Health is very aware of the need to make these connections across the public sector, and that is why we are very active in the public sector innovation network and encourage other agencies to do the same. The network fosters interagency collaboration and networking for our staff to support and build innovative capabilities. Health was also one of the 15 agencies which took part in the Whole of Government Ideas Management Hub online platform trial that ran for 10 months. The trial aimed to identify opportunities for the long-term strategy of idea management across the APS to enable better access to solutions for government. I'm proud to say that of the participating agencies, Health had the highest number of staff using the hub and the highest number of staff to generate ideas on the hub. And I'm not very parochial at all. But I think it is good. It shows that we have an appetite for ideas, an appetite for thinking about new ways to do that. Health is currently involved in all public sector innovation network initiatives right across the sector. And again, from my perspective, a very important message that we need to give, not only to the organisation, but also the APS. We have established Innovate Health Community SharePoint site to coordinate and promote our overarching APS innovation work and to enable our staff to follow the progress of our innovation strategy. We will continue to progress initiatives within our innovation strategy and to build a more collaborative, creative ideas culture. Getting the culture right, in my view, is basic to innovation. At Health, we need to continue encouraging ourselves and those around us to be innovative thinkers and to create space for conversations which explore ideas. And the idea there really is how to create space. We've had to shift our thinking from being tactical and problem-oriented to being strategic and policy-driven. And as I've said quite often in the organisation, after all, this is what a policy department is all about. Our role is to lead and steward the national health system by developing ideas to constantly improve it. Our focus areas are to drive innovation, people, policy, programs, regulation and strategic vision. In my view, innovation is both a journey, a destination and a skill set. We need to cultivate what I like to call the garden bed of ideas. Just when you need them, they need to be there. Some people might call them the plan A, B, Cs. Well, we need to be ready because things change, things go wrong, timing all of a sudden becomes right. So this idea, this culture of having this garden bed of ideas must apply to staff at all levels. This is not just about those at the top of organisation. Staff must feel empowered to think outside the box, to challenge those norms and make decisions appropriate to the level. The aim, of course, is to create the right balance between innovation, risk, facilitation and good governance. We can't overly focus on one without the other. Essential ingredient for this is to obtain the best possible data, information and evidence for policy formulation. And over the past 18 months we have focused very heavily on making sure that we can put data, analytics, evaluation and research at the centre of our strategic policy thinking. This is so we can see what is really happening in the health system, not just a gut feel or just assuming that this is what might be happening. A link to this, of course, is new technology and, for example, digital technology, which at the moment is changing quite rapidly, let me say. But we need to use technology around collection and transmission of the data. We need to be able to understand what that actually means. What are these new technologies going to do for us? How's our jobs going to change? We only have to think back 5 years. A whole range of the technologies we use today and the way we use them today did not exist. What's the next 5 years going to give us? If the world's knowledge bank is doubling every something like 60 or 70 days these days, what is that going to mean in 5 years' time? I think we need to have days like today where we can actually start to think about these sorts of things, even if we get it wrong, because we probably will, because 5 years is a long time in our environment today. But if we're not doing that, who is? So let's really get into that. In health, we are currently in the process of trying to progress our health innovation strategy. And for me, as I said earlier, this is a lot about culture. Promoting a culture that enables and prioritises partnerships and collaborations, learning, and also we need to recognise and reward. It's also, we need to include processes here. Sometimes we don't have the time and space to do that. Let's create the opportunities to actually do that. Today is one of them. Cross-agency collaborations, strategic project partnerships, training and support for staff across all of these sorts of issues, and looking at different ways of doing things, trialling different options. Part of it is, for me, adopting what I call a permission culture. One where staff feel they have the permission to try new and different things, or as I said before, sometimes old things. Have that permission, sometimes to make a mistake, but always to learn from it. Truth is, of course, we all make mistakes all of the time. If we didn't, we wouldn't be a learning culture. So therefore, we need to accept that mistakes happen. We need to make sure that we have the mechanisms in place to learn from them and not focus on shifting or moving away from any blame involved. A negative culture will suppress creativity and innovation, without doubt. In my view, the permission culture will energise and liberate people to think differently. They will have those opportunities to think about all sorts of things if they feel they can. And that's the cultural aspect that I think is really important. Associated with this, of course, we need to look at our risk management approach to support the growth in innovation within your organisations. Risk, in my view, is inherent to our conversation around innovation. And it doesn't mean we do stupid things. It means we look at risk, we understand it, we manage it, and we adapt ourselves to live within that framework. I think in health we are moving to a culture that is starting to accept that approach to how we start to think about innovation. I think we do need to push this quite a bit across the APS more broadly. And as if you can't hear up the back, someone's waving signs at me and it's beeping at me to hurry up. So I will not. Because I can be defiant as well occasionally, because I want to really drive home some of the messages here around what we need to do as APS people, leaders and workers. I think it is absolutely fundamental for national policy that we have the courage to actually make tough decisions, to call some of these different things and behaviours that go on, and be informed about our decisions that we're going to make. Collaboration and open conversation probably will be one of the key ways that I think we will achieve this. So let me start to wrap up before I get into too much trouble. I quite often say no one is the font of all knowledge, but collectively we've had a lot of life experience. We've all done different things. We've all done a lot of very, very different things. So if we've got nearly 350 people in this room this afternoon, or today, even with the rain outside, think about what we can achieve. So again, no one is the font of all knowledge, but collectively we might give it a pretty good shake. So we have that opportunity this afternoon. I want to look forward positively in thinking about how we can shape the public service, and in my case in particular, how we can shape health policy in a way that will benefit all Australians. And I think that is really, really important. We, as APS leaders, need to continue to lead by example and leverage the opportunities as they come our way through collaborations and partnerships. Health will continue to take a leading role wherever we can, and that's my commitment in this particular process. We will nurture and embed a culture which supports and maintains innovation in our policy, our programs and in our regulation. So I hope today's conference goes well for you. I hope it inspires and empowers you to go away and think differently in your own organisation, to take opportunity, have courage to put your ideas up. They might get knocked back occasionally, maybe get knocked back quite a lot, but you should not let that discourage you from keep trying and keep trying to get your ideas onto an agenda. So collaborate. We need to collaborate. We need to connect with each other. We need to foster the conversation here today. And if we do that, creativity and innovation will flow. Thank you all.